Frontline healthcare workers say they are burned out and they need help.
Nurses rallied on the steps of City Hall demanding hospitals do more to fill a critical nursing shortage. CBS 2's Kevin Rincon has more.
Nursing is a demanding profession that requires a positive work environment to promote job satisfaction and optimal patient care. A pleasant working atmosphere can boost employee satisfaction, lower turnover rates, and improve patient outcomes. An unpleasant work environment, on the other hand, can contribute to stress, burnout, and compromise patient care quality. Ladies and gentlemen, a very pleasant day to each and every one of you. I am Arlene and I am accompanied by a dedicated team of student researchers, Monica Javelona, Angel Ju, Nythanielle Libiano, and Juliana Llaguno. Together, we proudly represent Group 3A of BSNPF. It is my privilege to present our study entitled Level of Work Environment Satisfaction Among Staff Nurses in a Public Hospital. This study is the outcome of our commitment to exploring the detailed aspects that affect nurses' satisfaction within their work environment.
The study aimed to determine the level of work environment satisfaction among staff nurses in a public hospital. It focused on identifying the significant difference between level of work environment satisfaction among staff nurses in a public hospital and profile variables.
For the research design, this study used a quantitative descriptive research design to gather measurable data and describe variables related to work environment satisfaction among staff nurses in a public hospital. The goal was to determine factors influencing their satisfaction. A correlational research approach was employed to assess the statistical relationship between variables and explain how work environment factors affected nurses' performance. The study utilized a descriptive survey method with standardized survey papers distributed to a convenient sample of public health nurses in a local public hospital. Demographic information and responses to problem-related questions were collected.
The non-probability convenience sampling was utilized in the study. The participants of the study are the 80 public health nurses of the local government unit with hospital employment experience. Each public health nurses was given the option to accept or decline to participate in the research process by letting them sign a letter of consent. After the responses has been gathered, a subset of participants has been chosen from the population using a convenient sampling to achieve ethical results as well as non-probability sampling, as it does not require a full survey frame and is a quick and easy method.
The research aimed at using the study is a research-made questionnaire for the public staff nurses. The validity and reliability of the data gathered are critically dependent on the validation score on the survey questionnaire. For validation and reliability, the researchers submitted their research instrument to 3 nursing research experts, with the research instrument has been approved with a validation score of 4.59, which is interpreted as excellent. A pilot survey has been conducted. It's a mini survey where the researchers sent out questionnaire to a smaller sample size compared to the actual target audience. Researchers can assess the degree to which the items on the scale questionnaire are constantly assessing the same underlying contract by calculating the convex alpha. With the reliability result of 0.743, the study has been and survey has been approved as acceptable. To get the appropriate data needed, the questionnaire has 2 parts. Part 1 asks about the profile of the participants. It determines the participants' age, sex, and lastly, the length of service. This part of the question is the profile of the client respondent. It identifies the client's profile from personal to occupational aspects. It determines the ability of the client's response, identification of the research, and questionnaire being answered. The question is composed of questions with a scaling from strongly agree, agree, disagree, and strongly disagree. The questionnaire has 3 parts. The first titled Perceived Stress composed of questions regarding the client's stress before, during, and after his or her working hours in the hospital. The second part is the social support. It's composed of the questions related to the support when it comes to working before and during after the working hours. And the third and last part of the questionnaire is titled Coping Strategies. It is composed of the questions related to coping of the participants towards his or her work during and after working hours.
For the resultant discussion, the social demographic profile of the participants states that majority of the participants were female. They comprise more than half of the population at 67.5%. And for the age, participants of the younger adults group garnered the highest percentage of 56.3%. And for the length of service, participants who has worked for over or above 10 years has the highest percentage of 28.8%. For Table 1, it illustrates the level of work environment satisfaction among staff nurses in a public hospital in terms of perceived stress. Most of the results consistently indicate that staff nurses are satisfied with their level of work environment in terms of perceived stress. It provides strong evidence that the nurses generally perceive their work environment as positive and fulfilling. For Table 2, it presents a level of work environment satisfaction among staff nurses in a public hospital in terms of social support. The results consistently indicated that staff nurses are satisfied or very much satisfied with the level of work environment satisfaction in terms of social support for each question. It suggests that the nurses feel supported and connected within their work environment. And for Table 3, it illustrates the level of work environment satisfaction among staff nurses in a public hospital in terms of coping strategies. The results consistently indicated that staff nurses are very much satisfied with their level of work environment in terms of coping strategies based from the results. It suggests that the nurses feel equipped and supported in managing the challenges and stressors they encounter in their work environment. For Table 5, it presents a significant relationship between sex and level of work environment satisfaction among staff nurses in a public hospital. Generally, the data show that there is no significant relationship between the sex variable and level of work environment satisfaction among the staff nurses of the public hospital, since the p-value obtained was 0.241. And for Table 6, it illustrates a significant relationship between age and level of work environment satisfaction among staff nurses in a public hospital. Overall, the data show that there is no significant relationship between the age variable and the level of work environment satisfaction among the staff nurses of the public hospital, since the p-value obtained was 0.403. And for Table 7, it presents a significant relationship between the length of service and level of work environment satisfaction among staff nurses in a public hospital. Generally, the data show that there is no significant relationship between the length of service variable and the level of work environment satisfaction among the staff nurses of the public hospital, since p-value obtained was 0.189. And in conclusion, there is no significant relationship between the level of work environment satisfaction among the staff nurses in a public hospital and profile variables such as sex, age, and length of service in terms of perceived stress, social support, and coping strategies, since p-values were greater than 0.05, and the researchers accepted the null hypothesis.
Hospitals will need to understand the significance of nursing satisfaction given the rapidly evolving healthcare system. Results shows that the number one question ranked first, which has the highest mean of 3.6. Based on the results, the researchers have come up with several recommendations and suggestions intended to the head nurses and supervisors. First, increasing the empowerment in a welcoming workplace will enable nurses to be content with their work. Second, proper nurse counseling will help nurses focus on a healthcare goal or outcome and develop strategies that support patient care. Third, reduction of stress at work through minimizing workload of nurses and employing additional nurses. Revisions shall be made as the disease, healthcare system, and hospital establishments vary to the level of work environment satisfaction of nurses, especially in public hospitals.